everyone, it's Shari. While the idea of not having enough milk when you're breastfeeding seems to be a very common concern among breastfeeding moms, the concern or struggle that some moms experience with oversupply or making too much milk can actually be even more of an issue for those moms who are experiencing it. And I hear you all out there going, how can making too much milk be a problem? And it really can be a problem. So you really want to try to avoid this if at all possible. And when you start to see or you start to identify, and maybe watching this video, you're identifying that you are making an oversupply, you can start working on reducing that supply. Just remember, when it comes to breastfeeding your baby, what you want is just enough. You don't want too much and you don't want too little. Right there, what your baby needs at that particular time is what you want your body to be producing. And so oversupplying and making large amounts of milk, too much milk, can actually cause problems such as difficulty with latch. When the baby is latching and the milk is flowing too fast and hard, the baby could be gagging and choking on the milk. Plus, they may have a difficult time staying latched to the breast because there's just so much milk. You may start to hear clicking sounds when they're eating. They are coming off the breast, are not able to stay on and have a nice deep latch to the breast. This can cause fussiness and gassiness. It can cause too much of the foremilk, which we talked about in an earlier video, where there's not enough fat in that initial milk that's coming out, which can cause your baby to be extra gassy. So this could be a problem. It can also interfere even with your baby's weight gain, because as your baby is drinking a lot of this foremilk, it can be watery. And this is especially important in the early days where the baby needs a lot more fat. And if the milk is very watery, they could be peeing a lot, but not actually putting on the weight that they need to put on. So this could be a concern. And more importantly for you, large amounts of milk when your breasts are overproducing can lead to breast infections like mastitis. It puts a lot of pressure on the breast tissue to have the breast so fully expanded and extended for long periods of time. And this can lead to recurrent mastitis or breast infections, which can make you very sick. So it's important not to cause this kind of problem. Now, for some moms, this is just a genetic thing where they just produce a lot of milk, and some of these moms don't have any issues at all, and there are moms who donate milk, and there was moms who actually put that extra milk to good use. Or they're nursing multiples, and in that case, it's not really an oversupply, it's actually what your body needs to feed all your babies, whether 2 or 3. So that's not considered an oversupply. But for any mom who is making a lot more than what their baby is eating on a daily basis, I really encourage you to start feeding on more of a supply and demand schedule. And if you're creating this situation by over pumping, which means, you feed the baby and then you're pumping a lot in between feedings and you're thinking, okay, this is great, I'm storing up large amounts of milk in the freezer to use for a later date, this is really not a good practice, and I highly recommend staying away from it to keep yourself healthy and also to stay in sync with your baby. Typically, babies eat somewhere around 24 ounces, 28 ounces in a 24-hour period. If you're making larger amounts of milk than that, much larger amounts, you may have to reconsider, am I oversupplying, am I overproducing, and am I going to create more problems by doing this? Okay, I hope this helps you to really reconsider. And also the other part of this too is that some moms are producing just the right amount, but because they're no longer producing like they were in the past, maybe during the engorgement phase, they think they're not making enough. This is really important to keep in mind because, as we know, milk supply will decrease after the first few months, and especially after the first 6 months when your baby starts to eat solid foods. That does not mean you're not making enough for your baby. I hope this helps. Take care.